Cesarean and the home delivery, the general management we should given us. The outcome of the neonate depends on their ability to adapt to the extrauterine environment. They need to take over the functions of the breathing, maintaining circulation, nutrition, and excretion. 10% may require the intervention during this critical period. Routine delivery room care. After delivery, head held downwards in order to clear the mouth. Upper airway may be cleared with the rubber bug syringe or the catheter. In presence of meconium, larynx should be visualized and the meconium removed promptly. In fact, in infant, the depressed tracheal intubation and the suctioning should be done to clear any aspirated material beneath the glottis. In the first stage, the time-bound intervention, immediate and the thorough drying. The second stage we can go is early skin-to-skin contact. There should be properly timed cord clamping and the non-separation of a newborn from mother for the early breastfeeding. APGA or scoring. Devised by Dr. Virginia APGA to systematically assess the newborn and the subsequent adaptation to the extrauterine environment. The APGR is 7 to 10 is good, 4 to 6 is mild to moderate. A 5-minute score of 0 to 3 is the first sign of the asphyxia. When first 5 minutes APGR score is lesser than 7, the additional scores should be obtained every 5 minutes up to the 20th minute, unless 2 successive scores are 8 or greater. For the heart rate, if there is absent, it should be 0. If it is below 100, it should be 1. If it is over 100, it should be 2. For the respiratory effort, if it is absent, it should be 0. If it is slow or irregular, it should be 1. If it is a normal, regular, good one, the score should given is 2. For the muscle tone, if it is flaccid, the score is 0. Some flexion of extremities if seen, the score is 1. If they are active recoil, the score is 2. Reflex irritability, if there is no response, the score is 0. If there is grimace, the score is 1. If there is a vigorous reflex irritability, then the score is 2. While speaking about the color, if the color is blue or pale one, the score is 0. If the body is pink, extremities are blue, then the score is 1. If they are completely pink, the score is 2. Resuscitation. For the basic principle we should do is open airway, initiate breathing, assure circulation. The 3 signs to be evaluated is the first one, the respiratory rate, heart rate and the color. In case of primary apnea, the respiration may be induced by tactile stimulation, correct positioning and gentle suctioning. If asphyxia continues, the infant may result to having the secondary apnea requiring a positive pressure ventilation. Temperature regulation. Heat loss is easy due to the large body surface area, thin layer of the subcutaneous fat. The body heat lost due to the radiation, conduction, convection and evaporation. Practical ways to minimize the heat loss. Drying of skin, adequate dry covering for a baby. Avoid exposure to the air conditioner vent and the electric fan and contact to cold surfaces. Drop light over the bassinet provides the additional heat when the incubators and the warmers not available. Goal. Maintain the thermoneutral environment. 0. Range of environmental temperature wherein the baby is able to maintain the constant body temperature with the least metabolic expenditure. And the range of temperature should be 36.4 to 37.2 degrees Celsius. Cold stress results to the peripheral vasoconstriction, hypoxia, anaerobic metabolism, acidosis and the death. The more the preterm the infant, the bigger the surface area for the heat loss and the greater the risk for the dangerous hypothermia. Hypoxia, the blunts the normal response to cold. Subsequent care, dry cleaning of the skin with the sterile balls or the sponge. Excessive vernets may be removed with the mineral oil. Cube warm bath may be indicated in the marked meconium staining. Infant covered with blood. Secretion of foul-smelling amniotic fluid. Maternal history of the chorioamniotis, genital herpes or the hepatitis. Non-sterile delivery. Anthropometric measurements. Baby's weight, length, hip circumference, chest circumference if measured. 50th percentage for the Filipino weight at the birth is 3.112 kg for the male and 2.91 kg for the female. For the length, for the Filipino baby, we can find the 49.5 and 48.8 centimeter respectively as cited by the FNOC PPS cables. Eye care. Creed is prophylaxis. 1% of the silver nitrate or a topical ophthalmic ointment like erythromycin or tetracycline should be given. Protects against the gonococcal conjunctivitis. Vitamin K. Pythonoidine 1 mg given IM intramuscular to prevent the hemorrhagic disease of the newborn. While speaking about the nutrition, breastfeed within 30 minutes to 1 hour after the delivery. Subsequent nursing for demand basis. No prelactals or the supplementary feeding. Nursing mothers should be supported by staff and families as well. While speaking about the danger sign, basis for roaming in or keeping the baby for the observation and the management in the nursery, temperature instability should be noted. The heart rate, if it is lesser than 120 or greater than 160 per minute, and the respiratory rate should be maintained lesser than 40 or greater than 60 with the signs of distress, nasal, flare, grunting, retraction and the cyanosis. These are all the danger signs. Cyanosis pallor, change in the activity including the refusal to feed, lethargy, depression, jitteriness, seizures, delayed or the abnormal voiding and the bubble movement, excessive mucus, noisy respiration, persistent vomiting, abdominal distension, marked weight loss is greater than 90 grams per day, jaundice in first 24 hours. Estimation of the gestational age. For the proper anticipatory management, important if LMP not accurate or ultrasound examination not precise. Balance scoring is used, which combines both physical and the neuromuscular findings. Administered to all neonates, including extremely premature infant. Accurate if the performed between 12th and the 20th hour of life. Universal Newborn Screening. Newborn screening is a productive preventive health program. 5 parts including the screening, follow-up, diagnosis, management including the education with the counseling, implementation of the planned therapy and the elevation. Newborn screening, they are introduced in the Philippines in 1996. The screening of the Filipino citizens is the congenital hypothyroidism, congenital adrenal hypoplasia, phenylketonuria, galactosemia, G6PD deficiency. They all can be managed from the neonatal period with good outcome. The G6PD deficiency, this is the most common finding prevalence of 1:68%. And still newborn screening is a voluntary practice. Another screening is hearing the screening, being piloted in some centers. The prevalence of the newborn and the infant hearing loss is estimated 1.5 to 6 per thousand live births. Early detection before the 3 months of age facilitates the intervention. While speaking about the discharge, the consideration is mother-infant, maternal well-being and the stability of the infant's condition. Remember, the first 12 hours transition from intrauterine to extrauterine environment, and the first 24 hours the observe for the pathologic jaundice. In early discharge, unavoidable is lesser than 24 hours. The measures should be taken for early follow-up of both mother and the baby to detect the onset of significant problems. Thank you.